Alrighty, good evening. Welcome to Vax Facts and FAQs. We are going to get started. I am Amiris. I am with the National Kidney Foundation of Michigan. And we are also joined with Teresa Tejada, who's behind the scenes, and she's going to be providing us with technical assistance and monitoring your questions in the chat. So feel free to send your questions throughout the presentation. All right. So like I said, this is Vax Facts and Facts. And the goal of this presentation is to provide you with some new information that's come out with COVID and the vaccine, and to answer some questions that are common throughout the pandemic. Next slide, please. So today, for our topics, we have vaccine in the news, which is a portion where we will be going over some of the trends and some of the data regarding the vaccine and COVID. The other topic we have is the home coronavirus testing, including discussing how you can get your free coronavirus test from the government. We'll also go over coronavirus treatment options that are available, and then we will end with the FAQs portion of our presentation. Next slide, please. Okay, so starting out with COVID-19 trend updates. So as of February 16th, 2022, the current 7-day moving average of daily new cases has decreased by 43%, compared to the previous 7-day moving average. So it went from 213,625 daily new cases to 121,665 new cases. And also, as of February 16th, 78,060,327 total cases of coronavirus has been reported in the United States. Next slide, please. Now we're going to look at some of the trends regarding vaccinations. So this is also as of February 16th. So the overall about 252.4 million people, or 76% of the US population, has received at least one dose of the vaccines. About 214.2 million, or 64.5% of the total total population is fully vaccinated. And of those who are eligible for their booster shot, only 50% of the population has received their booster shot. Next slide, please. And also something we thought was really important to mention is there has been some changes in the recommendations for people who are moderately or severely immunocompromised when it comes to their booster shots. So the recommendation now is if you have completed a primary series of an mRNA vaccine, which is Pfizer or Moderna, it is recommended that you receive an additional mRNA dose 3 months instead of 5 months after those 2 primary doses. And if you have received a single dose of Johnson & Johnson, it's recommended that you receive 1 additional dose of an mRNA vaccine, and then a booster dose for a total of 3 vaccine doses. And once you have completed your primary series of 3 vaccine doses, it is recommended to receive a vaccine booster, making a total of 4 vaccine doses. Again, this is for those who are moderately or severely immunocompromised. And as always, it's recommended that you talk with your healthcare provider if you have additional questions about whether you should consider these additional doses. Next slide, please. And here, to make it a little more clear, I think it's a little helpful to see it in this format. We have provided a vaccination schedule for those who are moderately or severely compromised. Again, it just makes it a little easier to see what the recommendations are based on what vaccine you received. And again, don't hesitate to consult with your healthcare provider to ensure that you are on track and up to date. Next slide, please. The last thing in the news is we are going to talk about Moderna. Moderna, which is now called Spikevax for its marketing purposes, has been FDA approved versus being in emergency use authorization, or EUA. So now it's FDA approved for primary series of 2 doses given 1 month apart, and also for the single dose booster 5 months after completing your primary series. And this is for those who are 18 years and older. Similarly, Pfizer is also FDA approved. This happened a little bit before Moderna, and it is approved for those 16 years and older. For the population that's 5 years old through 15-year-olds, it's still an emergency use authorization, the vaccines. Thank you. Next slide. Okay, so now we're going to just provide you some additional information regarding self-testing. And the first thing that it's important to note is that the self-tests for COVID give rapid results. They are the rapid antigen tests. And so you typically receive your results within 15 to 30 minutes. Also, the tests do not detect antibodies, which would indicate previous infection. And they also don't test your level of immunity. So that's important to note about the self-test. And lastly, testing at home, along with the other practices that we've been practicing throughout the entire pandemic, such as wearing a mask, social distancing, hand washing. It's just another level of protection that helps reduce spreading the virus among our community. Next slide, please. So this infographic is from the CDC, and it can answer some frequently asked questions, such as when you should get a test, and when, what types of tests are available, and what you should do after you test positive and after you test negative. So the first category we're going to go over is when you should get tested. So the first reason to get tested is if you have symptoms, or if you have suspected that you've been exposed to COVID-19, or if you know that you've been exposed. Also, you may get tested for screening purposes for school or work. You may get tested before traveling as a travel requirement, and you might just be prompted by a healthcare professional to get tested. There are 2 types of tests, kind of like we alluded to earlier. There is the laboratory test, where you would receive your results in 1 to 3 days instead of the rapid results that you would get from your home test. They are a nasal swab or saliva, and the results are reliable no matter if you have symptoms or not. And follow-up for this test is not required. And the most common, a common example of the laboratory test is the PCR test. And the rapid test, which is what the home tests that you would get from the government would be, are typically a nasal swab, and the results are 15 to 30 minutes. And the results may be less reliable for people without symptoms. This may be the case due to you not having enough level of the virus in your system, and these tests are sensitive, so it might not pick it up. And follow-up may be required a lot due to that. And so you may get follow-up to see if you test positive with maybe a laboratory test, or if you test negative with a laboratory test, just for additional confirmation. And a common example of that is the antigen test. So what to do if you test positive? The first thing is isolate and to seek confirmation that you do have COVID. So you could receive a laboratory test if you receive the rapid test initially, and then monitor your symptoms to ensure that you don't need additional health attention as you recover from COVID. And if you're negative, if you're fully vaccinated, then you can return to your normal activities. It's recommended that you wear a mask indoors in areas of high or substantial community transmission. And if you're not fully vaccinated and have symptoms or exposure, to continue to quarantine, especially until you can get an additional test. And if you have no symptoms, then return to your normal activities. And consider taking steps to get vaccinated to protect yourself and your community. Next slide, please. So this is the landing page after you visit covidtest.gov, which is the website that you would visit to order your free at-home test. And so what you would do is click on your the bright blue button that says order, and you'll be prompted to the next page, which is on the next slide, and you'll be prompted to enter mostly just contact information. You will not be prompted to enter your credit card information, and then you will receive 4 COVID tests to your home, and each home is only eligible to receive 4 tests. Next slide, please. Okay, so now we're going to talk about our treatment options. But before we do, I do want to let everyone know that Friday we will have Dr. Silas Norman on the live stream on Friday at noon, where he will be able to answer more specific questions about COVID treatment options. So if you're really interested in that, I do recommend that you tune in on Friday at noon. But I'm going to provide a quick overview of what you need to know about the treatment options that are available. So regarding the treatment options, there are more treatment options available today than there were at the start of the pandemic. That includes oral tablets, antivirals, and monoclonal antibodies. However, with nearly 100% of the cases resulting from the Omicron variant, the FDA is limiting some drugs authorization based on how effective it is against the Omicron variant. In other words, if a monoclonal antibody isn't proven to be effective against the Omicron variant, it won't be recommended that you use that treatment as an option at this time. So we suggest that you check with your physician on which treatment is right for you and currently which treatments are authorized for use at this time. There are a few listed on the screen, And these treatment options are currently available and are effective against the Omicron variant. Next slide, please. So now we are at our FAQ section. This is a great time to send in your questions, and I will do my best to answer them. But I have provided some questions here to help us get started. So the first question is, if we need a booster shot, are the vaccines working? And it's a great question. The answer is yes. COVID vaccines are working really well at preventing severe illness, hospitalizations, and death. However, the reason why booster shots were authorized is because public health experts noticed reduced protection over time after the primary series was received against mild and moderate disease, especially among some of our most vulnerable populations. So the next question is, I got COVID and I recovered. Do I still need the vaccine? And again, the answer is yes. It's recommended that you do get the COVID-19 vaccine, even if you have already had COVID. And it's recommended because while you do get some protection from COVID-19, which is referred to as natural immunity, the level of protection that you get, it's hard to measure. It's hard to decide how much immunity you received. It's not really possible to test that at that time. And also, your level of immunity or protection from having COVID-19 could vary on numerous things, including how severe your illness was, how long it's been since you've been infected with COVID-19, and possibly your age. Next slide, please. Okay, so the next question is, as cases are winding down and mandates are being lifted, do we still need to worry about COVID-19? And sadly, we do still have to worry about COVID-19. This is especially true for our most vulnerable populations, like those with kidney disease and transplant recipients. While the cases are going down, transmission of the virus is still possible, and it's especially possible in counties like Wayne County, where there is a high transmission rate at this time. So continuing our protective practices, like wearing a mask, social distancing, and getting vaccinated if you're not vaccinated, can keep us on this track and keep our most vulnerable safe. And the next question is, do the COVID-19 tests ever produce a false negative? Sometimes this does occur, and as I kind of hinted at earlier, it's possible to receive a false negative result, especially with the antigen tests, because it could be too early in your illness for a test to be detected by that test. So if you receive a negative test and continue to have symptoms, isolate and then possibly wait a little bit longer and then retest. When I tested positive for COVID-19, I tested negative first with the antigen test and tested positive with the laboratory test or PCR test. So that was my experience, and I think it was just too early for the antigen test to pick it up. Next slide, sorry. Why is there so much attention on getting vaccinated and not on other healthy behaviors? So other healthy behaviors likely includes eating a balanced diet, exercise, and hand washing and other hygiene. And the reason why there's not as much focus, at least this is my take, is These are already widely accepted as protection against the virus, and also they're also widely accepted as protection against developing a chronic illness and managing a chronic illness. So a lot of people are already on board with exercise and balanced diet, but more encouragement is needed for vaccination. And vaccination is ultimately the greatest protection possible when it comes to preventing hospitalizations, severe illness from COVID, and death during this pandemic. And so if you are eating healthy and you're exercising, that is so great, and you should keep doing that. Those things, again, help prevent and manage chronic disease, which we know is a risk factor for COVID-19 and moderate to severe complications or illness with COVID. The next question is, what can I say to a friend or family member who won't get vaccinated or wear a mask, but still wants to spend time with me, even though I am vulnerable? And my take on this is that it's important to share as someone who's vulnerable to complications from COVID, to having moderate to severe illness from COVID, possibly getting hospitalized with COVID, is to share that with people. Some people may not be aware, and also to share what that means to you, share what that means to your family, and really encourage them to add more protection for themselves and for you and for other people that are also vulnerable. And then ultimately, you have to decide what protection you need. And if that includes limiting your contact with this friend, then that might be what you have to do to keep yourself safe at this time. So we have reached the end of the presentation, and I want to thank everyone for joining us. And if you have questions or feedback, you can reach us at reach@nkfm.org, or you can visit our website at nkfm.org. We are going to do these live streams monthly, but we also have one coming up Friday with Dr. Silas Norman. So if you're interested in reminders, so you don't miss these presentations, feel free to register at the link that we have on the screen. And I hope you have a great rest of your night. Thank you.